The nematodes are interesting as well. These are roundworms. Nematodes are one of the most common animal species on the planet, and there are a few of them that can cause infections in humans. There's Strongyloides, which can affect animals and humans, and they're normally transmitted from the animal to the human through eggs. You pet the animal and then you stick your finger in your mouth. So stop chewing your fingernail. And they're really small little worms. They get into the intestinal tract. And if they're left untreated for very long, they can perforate the intestinal tract and cause abdominal infections that can be harmful and fatal. Ascaris lumbricoides. These are some of the most common parasites that you get in young puppies. They're very large worms. They're sexually dimorphic. Males and females can easily be differentiated because one has a hook and one doesn't. When you use piperazine or a treatment for those parasites, it paralyzes the worm. The worm's not dead, it's just paralyzed, so it is passed out of the intestinal tract in these large clumps of worms. They're some of the easiest to get rid of as well. Pinworms, Enterobius vermicularis, they can cause the anus to actually prolapse and collapse and push out the anal area. The females come out at night and lay their eggs around the anus, so there's a lot of itching and scratching in the anal area, and that's how they're transmitted. You scratch and then you touch an inanimate object and somebody picks up the eggs. These are fairly common in the United States, not overly, but as far as parasites go, in humans they can be. How do I say? You'll scratch in front of the Pope. That's how itchy they are. You normally see it transmitted from, like in daycares or in places where you keep a lot of kids. The test for it is called the Scotch tape test. You take a piece of Scotch tape, and while the child is asleep, you separate the little butt cheeks and you touch it around in that area and then put it on a glass slide and look for the eggs, or even the adult females, which are still fairly small. Trichinella spiralis, it's very low numbers, but it's found in uncooked foods like pork. And the main reason it gets in pork is because the pigs will chase down rats and eat them. And I see that I've got a misspelled word there. That was not intentional. And it should be spiralis. Trichinella spiralis, the females will encyst in the muscle, and then it becomes calcified by your immune system, and there's no treatment because the drugs don't penetrate the calcified thing. So she's waiting inside your muscles for someone to eat that muscle tissue. And if you can't do surgery and remove it, because if you do, you release the eggs, and the eggs hatch, and it just compounds the problem. So the best way to avoid getting trichinella is don't eat undercooked pork, especially if it comes from a private farm. The one good thing you can say about the big pig farms is that they have the pigs up off the ground, which makes it easier for them to keep clean, but it also keeps the rats and mice away. And so you don't normally find it in USDA inspected meat. It's usually if you're getting sausage or pork from Uncle John, who still has a few pigs. It causes the heart and diaphragm that's the area where those cysts tend to form. X-rays can determine that you've got that. Loiloiasis, or the eye worm. This is a nematode roundworm that will crawl literally across the eye, and you can see it move across the eye. You have to take a thin scalpel cut and pull the worm out with a pair of tweezers. For some reason, the drugs don't penetrate in a high enough concentration into the eye to cause the worm to die, so it's hard to treat except by literally pulling them out. Onchocerca causes river blindness. It was at one time one of the most common causes of blindness in the world. It causes separation of the retina and scar tissue formation. So now they have a lot of treatments that they can give to patients that live along the Nile River in places where onchocerca can be found. It is transmitted by biting flies. Last but certainly not least is Ranunculus metanensis, one of my favorite parasites. This is called the fiery serpent. The females and males meet up in the intestinal tract where they breed. Then the females will burrow their way through the intestines and move down along the skin, underneath the skin, and she'll release enzymes that burn a hole through the lower leg typically. And then medicine men used to walk around different villages and they would use small sticks and they would tease the worm out and wrap it around the stick. But you had to really trust the guy, because if you didn't and he broke the worm, the female would release that same enzyme over her entire length, which could be a meter or two long, and literally burn you from the inside out. They say it's excruciatingly painful, and it's almost like you've had a torch put to you in a fine line up down the area. I've seen images of ranunculus making their way into the scrotum of males that were infected. It's one of the diseases that's being targeted by the World Health Organization for complete obliteration. So they're doing things like treating areas that this occurs, and the number of cases per year is really low. But since it's the impetus for the caduceus, the medical symbol, the snake going around the medical symbol, I thought it was an important one to include.